Well, very interesting. I mean, first of all, as we know that phimosis is that where we can't pull back the foreskin behind the glans. So in children, it is mostly a physiological thing. Most baby will have a phimosis. We call physiological phimosis. But it could be a pathological one, abnormal one, and the commonest cause is the infection. It could be acute infection, or it could be a chronic infection where parents will say that child is unhappy, irritating, he's itching, all those things. It's all the time red. Uh, so that's called chronic balanitis. That is a very common condition, but it has also been seen to be associated with history of diabetes is there, or eczema of skin is there. In adults, it could be associated with some sexual transmitted disease, but not in children. So there are so many associations, but the commonest cause, which I think all the GP, all the parents should know, that it could be a physiological as well, which doesn't need any treatment, so must be examined by a pediatric surgeon. And the symptoms are like normally, if you see the foreskin should become retractile, that means it can be pulled behind the glans around 5 to 7 years of the age. In many children, it is as early as 1 year even, but in some children, it is as late as 9, 10 years of the age. Uh, so that is the commonest symptom. But with that, what happens that they can't keep it clean, so there is recurrent infection, so the things becomes painful, uh, irritating, lot of itching. Sometimes they have a frank symptoms of urinary tract infection, so they do get some blood in the urine, frequency, so passing urine more frequently, unpleasant smell, a lot of smells were there. uh, and in teenager, we do see the painful erection also, like in sleep, or they get hardening. They're very painful. So these are some of the symptoms which it can present to us. I think it's important to know whether it is a physiological phimosis or a pathological one which needs treatment. So it should be seen by a pediatric surgeon as soon as possible. Because if it is a physiological one, it doesn't need any treatment. It just needs keeping it clean and putting a moisturizing cream. But if that hygiene is not maintained, many of these physiological phimosis can become pathological one, so that they will get recurrent infection, the skin becomes red, inflamed, tight, and gradually they become quite scarred. So definitely it should be seen as soon as possible, so that the proper hygiene, proper advice could be maintained, and it doesn't become a pathological diseased phimosis. I think diagnosis is clinical. We just see it that the foreskin is tight. If it is healthy, like no scarring, no redness, and all, then we call it a physiological phimosis, and we just advise some conservative treatment to keep it clean, putting moisturizing cream. But if it is red, inflamed, scarred, or one condition we are always worried is called BXO, that is called Balanitis xerotica obliterans. That means we see white scarring. If that is there, that is quite concerning condition that needs urgent treatment, because it has got some association with later stage with the cancer and all as well. So if there is a BXO type of symptoms, then it needs to be treated urgently. So I would say as it should be seen as soon as possible, so that what exactly going on we can find out clinically. So treatment, as I said, like if the physiological phimosis, which is normal in children, they don't need any surgical treatment. They just need keeping it clean in the bath, drying it, and putting any moisturizing cream, gently wriggling the skin, because the separation of the foreskin is a hormonal phenomenon. So not forcefully pulling it, just gentle wriggle, cleaning it and all, putting moisturizing cream. But if it is a BXO, it's a white scarring. As I said, it has got high risk of cancer and all. It needs circumcision. But in between, there's just a spectrum where there is chronic balanitis, scarring, UTI, painful erection. So it's a symptomatic phimosis, then definitely it needs surgical intervention. So risk are, as I said, the commonest is even if it is physiological phimosis, if you're not keeping it clean, then the skin get infected because the normal secretions are there, normal bacterial flora are there, so they get accumulated, and the physiological phimosis turns into a pathological phimosis by recurrent balanitis, acute or chronic. Then sometime what happens, the child tries to pull it back forcefully, so it bleeds, sometimes it tears and all, and the skin which is pulled back doesn't go forward. That becomes the whole glans and the top bit becomes swollen. That's called paraphimosis. That's an emergency condition. But one important risk which I would like to mention is a condition called BXO, balanitis xerotica obliterates, in which we see the white scarring. And I have said that it has got a long term risk of cancer later on. So that is one risk with the chronic balanitis and long term pathological phimosis. So definitely BXO must be ruled out and treated as soon as possible.